Welcome to the clinical practice and ethics presentation of the exploitation of a vulnerable client. In this case, we will be examining the emergency suspension of the license of Megan Burnett, a licensed clinical social worker. Ms. Burnett was working at the Morse Life Health System in West Palm Beach, Florida, and was a case manager for the female resident SM, which is a 73-year-old woman diagnosed with unspecified Alzheimer's disease. Between the estimated dates of February 25th, 2023 and June 10th, 2025, Ms. Burnett used SM's TD Bank account 55 times to pay for a debt totaling $68,540.57 on her personal Capital One credit card without SM's consent. The debt was a combination of veterinary care, spa services, and car repairs, which were all personal expenses of Ms. Burnett. Ms. Burnett also used client funds without consent and called Capital One an impersonated resident SM. She also claimed that she was authorized on the account. The impact is that on September 3rd of 2025, Ms. Burnett was arrested for the exploitation of the elderly, money laundering, and personal identification fraud. She also had her license emergency suspended. The ethical codes that were violated were many in this case. However, Ethics 1.05D and 1.06 pertain to how Ms. Burnett's actions took advantage of SM for personal reasons and to her status as a member of a protected class due to her age. Ethics 1.14 also reflect on SM's potential decision-making capacity in light of her Alzheimer's diagnosis. Ms. Burnett also violated Ethics 4.04 and 4.05 by allowing her overspending to lead her to engage in deception, dishonesty, and fraud to access and use SM's bank account.
In this case, it's an obvious breach of many ethical violations, as we saw through the NASW Code of Ethics. As a social worker, we're upheld to many basic standards, which is to really care for our clients, respect our clients, and be trusted with anything that they need, especially when we're talking about a vulnerable population. In this case, the client SM had Alzheimer's disease, which increased their vulnerability as they were an elderly individual at 73 years old with a cognitive disorder that would cause them to potentially have memory loss and other issues moving forward throughout the case that Burnett clearly took advantage of. Burnett, as an LCSW, showed that she could not act in a professional, responsible, or respectful manner with her client, and is an immediate danger to the health, safety, or welfare of the public, as she could continue to act that way with more vulnerable populations and drain their finances in the future as she's employed with Morse Life. When we're looking at the impact overall, we have to think large and small. For the client, we're looking at big impacts for financial loss, emotional betrayal, and reduced trust in the future for caregivers, as it's seen that commonly with individuals that have to entrust their care, when that bond is broken, like the therapeutic alliance, it's very hard to mend that even with future individuals working with them. Professionally, for Burnett, there's a loss of employment, arrest and criminal charges, and license suspension, which, as we all know, we work really hard to get here in this field. So that's a huge impact on the future of Miss Burnett. For the agency, Morse Life, and for their community, there's a damage to reputation, a large need for internal investigation, because this case went on for 2.5 years and no one ever caught or had a report that Miss Burnett was doing suspicious activity of any sort. And there's also a potential loss of community trust as this hit the news. There were multiple articles in West Palm Beach and in the greater Florida area of this case, and it created a lot of commotion.
When it comes to the analysis of this dilemma, there are some contributing systemic factors. One of those factors is that Ms. Burnett, she is a clinician, and due to that, she's not required to be supervised. However, that allows some things to get slipped through the cracks, such as Ms. Burnett exploiting the client who has a diagnosis, which is causes for a high risk. And that allows a lot of things to get slipped through the crack and causes for fraud. Another factor is that it comes with cultural factors. And one of those cultural factor is was research that in Florida is one of the highest ranked fraud that has been reported. And that in the cities that has been reported is West Palm Beach and Miami, which are very high and known for fraud. And due to that, the cultural factors can also inhibit Miss Burnett to participate in these activities. And clinicians deliberately made 55 personal transaction and falsely claimed she was on the account, reflecting the systemic factors of a normalized environment in which fraud can occur.
With the information of the case provided, our conclusion and proposed solution is that the situation should have been avoided. Burnett is likely familiar with the NASW Code of Ethics, being that she was a licensed clinician. So she should have known that this was not the opportunity to exploit the client, especially due to an Alzheimer's diagnosis. So having that supervision and also the tracking of financial transactions should have been required to catch this sooner, as well that the client's well-being should have been the primary consideration in this case to avoid it altogether. So for steps for the future, we should require supervision as a policy within Morse Life that ensures professionals are being held accountable. They're having their documentation viewed regularly. They provide guidance and support, such as just financial assistance, just in case Burnett was going through something that led her to do this. But also implementing just continuing education units to keep her license valid, but also reminding her about the NASW Code of Ethics to keep in the back of her mind, and also establishing clear boundaries with clients served so this doesn't happen again. Here are our references, and thank you so much for listening. Have a good day.